Assalamu alaikum. I'm waiting for more sisters to join in. I'll be waiting for like 15 minutes and then we'll start inshallah. I'm just waiting for a few more sisters because I think that sisters in UAE are finding it a bit hard to join in at this time. So we'll probably start around 4:30 inshallah. 4:30 India time. Assalamu alaikum. I think we have enough attendees. I think we can start now. Am I audible? Can you please give your replies in the chat box? Am I audible now? I have just put on my headphone.
Yes, sir.
Okay. Okay, Bismillah. Assalamu alaikum wa rahmatullahi wa barakatuhu. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. My name is Aisha Abrar, and some of you might know me. I am a lactation specialist since 7 years. I am a certified prenatal postnatal exercise specialist by IHFA India, recognized by the Indian government. I am a Sunnah and traditional birth doula advocating for Sunnah and traditional birth practices. I am also an infant feeding advisor in microbiome, gut health, immunity, and weaning and sleep. I am also a diploma in natural nutrition. Now, this orientation for the confident birth is basically for mothers who wish to know what exactly my course would contain, how I go through my course, and inshallah, how we will benefit from this course. So before I start about the course, I would like to let you know a little about me, because you are working with me for childbirth education. You are taking the information from me. So I am responsible for letting you know about me so that you know where I come from and what kind of experiences I have gone through. Inshallah, what I would be teaching as well. I am a mother of three naturally birthed children in UAE, all of them. I have just relocated to India. I have 7+ years experience in lactation support. I am also researching and documenting births that I support virtually currently, and also I document and research all the postpartum support that I do for mothers. I have been supporting over 200 mothers since 2022 till date. I empower mothers for instinctive active labor so that they understand how their bodies work. I advocate Sunnah and traditional birth best practices that are beneficial from the root. The way she understands her body and how it moves, how it behaves during labor, and how it behaves during pregnancy. So, apart from the technical information, I also give emotional support to the mother in the form of doula and lactation counselor, and even also a pregnancy educator. I help her rely on the Sunnah and traditional based practices so that she understands how Maryam alayhi salam also was helped by Allah during her pregnancy and adopting certain means for attaining the desired result. Coming to what is confident birth. Um, since there are seven of you here, before I get into this topic, can you tell me what do you know about confident birth? What do you know about natural birth and normal birth? So if you can either unmute yourself, you can speak, or you can just let me know through the chat box.
Uh, I'm not sure, but confident birth. Salam alaikum. I feel like, because during birth process and all, we are too much feared. So maybe it gives out confident tips to how to overcome such fears. Allah.
Jazakallahu khairan, sister. Your name?
Shabnam.
Shabnam. Jazakallahu khairan, sister Shabnam. Anyone else would like to contribute? Does anyone else want to let me know what they know about confident birth, normal birth, natural birth? Okay, moving on. I have already done the introduction to the facilitator, that is me, where I'll be supporting you for the confident birth journey, inshallah. About this course, now, what is confident natural birth? Confident natural birth means you are taking course of your pregnancy and understanding your physiology as a woman. We all need to know what is the woman's physiology, how does the woman's reproductive system work, how does her body work during pregnancy, how does it behave, how does the body behave during pregnancy, during labor, birth. We all study about our emotional health during menstruation, during different times of our cycles, but we don't study how the body behaves when it is responding to certain triggers during pregnancy and certain triggers in labor. So we don't know exactly what to expect. So what the medical system tells us in based of fear based education is that, oh my god, if there's a complication, you need to come to me tomorrow, you need to come to me now, without any explanation or without some vague explanation or some vague terms which you are not allowed to question for. So a care provider that allows you to question is the good care provider who helps you in understanding your body, in understanding your course of your pregnancy and labor. When you're not allowed to question, when you're not allowed to get educated in the hospital setting, then that place is not the right place for you to birth naturally and confidently. In olden times, if you think, how did our grandmothers birth and who came for their births? What did they know about births? Even if they didn't know anything about the technical aspects, like you have induction, you have augmentation, you have so many ABCs of technical aspects in the medical industry right now, which we need to know because that is being introduced in our systems during pregnancy or labor. But in the olden times, although this wasn't there, even then the mothers, the grandmothers, they didn't study or they didn't know what ABCs of pregnancies are, but they saw their relatives, they went and experienced different births, they knew about each other, right? So just one second, someone has entered, I guess. Okay. So in our olden times, our grandmothers, they all experienced, they saw, they witnessed, visually they understood how a mother behaves during pregnancy and how she needs to behave during labor. There were these daimas used to come and they used to help her breathe, help her move, help her do everything that she needs, and the birth used to happen at home. There were no medical interventions, and wouldn't find a lot of complications. The complications are nowadays mainly because the inductions have increased, unnecessary inductions have increased, rather. When the induction or when the intervention is necessary, then absolutely you need to go ahead with what the doctor says. If there is a medical reason, if there is a medical backup, if there is a report that is talking about the complication, if the evidence is there. But without evidence, just based on fear, just based on what the doctor is just telling you to do tomorrow, today, day after, it does not necessitate anything that is needing an intervention in you, and you are meant to lose confidence and you will not get the natural birth. So there everything falls, and you are just birthing under the medical system that okay, mother and baby is fine and everything is going on as per how the system has to go, right? So this is where the goals and the outcomes of the program I wanted to share. One second. Okay. So, coming to the goals and outcomes of the program, this is where you will learn why you are studying confident natural birth. Why are you studying the physiology? What do you need to understand how the labor works? What happens to the cervix during labor? Also, we will be discussing some amount of complications and to what level you need to consider dealing it at home by yourself, and at what level you need to get the intervention done either through a midwife or through a doula or through the doctor itself who will intervene when it is necessary. Wanted to notify that please join the same link in 10 minutes as this meeting will end in 10 minutes. Okay. So we will discuss about the goals and outcomes of this program in the childbirth education when we start. So for now, as the orientation session, the goals are basically to lead you to a more confident natural birth and ask the right questions to the doctor. This should be your goal in achieving the most uninterrupted, uninterventional form of birth, rightly so decided by your informed decision along with your husband, along with the birth partner that you are birthing with. So, your goals would be that you achieve the most natural, the most peaceful, the most smoother, and a most happy birth that you can dream of to get pregnant again. You should not be fearing pregnancy again, right? So, if you fear the second pregnancy, that means there is something wrong which has happened during your start of your previous birth. So, the goal of this course is to help you become confident in your own body system, in understanding your physiology, in understanding who you are as a pregnant mom and who you are during labor, because we all mothers are different in labor. All mothers are not getting the same type of exercises during labor. There will be a mother who has a posterior baby, there will be a mother who has an anterior baby, there will be a mother who has a slow progressing labor, there will be a mother who has maybe some pains in her left or right joint. So all the methods of supporting her during labor is going to be different. So you understand yourself in this program. You understand your body, you understand your mind, you understand yourself as a woman in labor, as a woman who's pregnant. And the outcomes of this program, inshallah, would be that you come out as a more confident mother who will also be able to help your children once you get this education, so that you don't need the interventions of the now and then interventions which are not necessary. Should not be needing them in terms of getting help every now and then without education. So when you are more confident in your body and yourself during pregnancy, during labor and postpartum, you know what to do. You know what kind of support to seek for. You know what needs to be done. A, B, C. Next, you note down things. You study yourself, you study your birth, you study your own postpartum, because it is very good when you are actually experiencing your own um, journey of pregnancy and noting things down so that you know what to do next, right? And also with the support, but you are more confident in dealing with your pregnancy and birth so that you do not need any support further on. You are there first, second, third. Your support actually should reduce. You seeking that support for the natural birth should reduce as you get uh, as you get pregnant for the second or the third time. You should not be seeking doctors again and again and again. So, inshallah, the importance of informed and empowered childbirth is what I have already discussed in this session. I've introduced this topic to you. So, when you are well informed and empowered, you are more confident decision maker. So, understanding the female physiology would be the first topic that we'll be discussing during my course. This physiology will help you understand yourself, how your body works, how a woman's body works during the reproduction. You will understand your ovulation. You will understand how the uterus works during labor, how the muscles and the fascia also are acting during labor. Right now, you will not have some information to these technical terms, but inshallah, during the course, I will be speaking about these things and explaining how your body interacts with you when you are pregnant and when you are also um, during the time of conception and fertility, how understanding your ovulation and fertility cycle helps, because you can't just understand pregnancy without knowing anything before that, right? You will also be understanding how your body works during pregnancy, what are the moves that you need to do during pregnancy, during labor, how you need to take care of your pelvic muscles. Understanding your pregnancy is something that is very wide, broad spectrum, where you will understand the nutrition you need to take, the kind of emotional health you need, and understanding your labor would be the most crucial, because labor is something that is going to be the deciding time of your life during pregnancy, whether you're going to be pregnant again or not. If it is something that is causing trauma to you during labor, it will not encourage you to become pregnant again. You will not want to birth again. You will not want to feel the labor pain again. Many of us, why do we opt for epidurals? It is because that we don't want to face the pains of labor. We don't want to face this or that. We have been educated by fear in terms of the complications that are arising. So if you understand how your labor works, you will face that more gracefully, because Maryam alayhi salam has also faced it gracefully. You will understand your birth. When your birth is happy and non-traumatic, you will know what to do with your baby and yourself postpartum, and how you have to feed the baby, how you have to help yourself in relaxing yourself, in getting the good sleep, in getting the good amount of nutrition that you require. Of course, all of these with the support that you have, but there are mothers who don't have support as well. So if you understand through me, through these classes, through me having your mentor, because I do provide mentorship, through me having your support guide, by asking questions, by having some sessions, but you need to study along with me. If you don't study, if you don't make notes, if you don't document your previous pregnancies, there are high chances that you may want to seek the same kind of support again, which may lead you to just depending on the educator, right? So I am an educator who wants to educate a mother in such a way that she does not come back to me for the second time, and she is more educated, she is more empowered. That is empowerment. Empowerment is when you get something and you know about it, but you do not seek the same kind of support to that same level again. You are well educated, you are well informed, and you are more confident in leading your next births. And this is how I became a childbirth educator. I tried to get the education, I studied my pregnancies, I studied my births, and that's how today I am a childbirth educator and a counselor as well for lactation. Because the more you become experienced with your own birth is not a pathological event. It's not somewhere you become a patient of. that particular doctor. You are a mother, you're becoming a mother, your life is changing, your mental health is changing, your physical health is changing, everything is changing, your relationships are changing around you. In a day, when the baby comes in this world, your relationship with your husband, your mother, your sister, your friend, your neighbor, everything changes in that 1 minute after you give birth, because that is where you become a mother. The birth of the mother takes place. So when you understand yourself, your body, your pregnancy, your labor and birth, this is where you understand the whole realm of this pregnancy. So just introducing you all to science of natural birth. What is the science of natural birth? It starts with birth physiology. What are the hormones involved in labor and birth? How do contractions work? Role of oxytocin and endorphins. How fear and tension pain cycle causes to reduce the pains of labor and also lead to a complication. So this is what will be covered in detail in the natural birth course. So you will also be studying preparation for natural birth, how the birth environment should be, who should be your support partner, how should the support partner behave during your labor, what are the comfort measures in labor, what you can seek, the natural comfort measures, the natural induction measures, what are the measures that come second.